In the skilled hands of Baptist Health South Florida's medical experts, the digital technology that has changed the way we communicate, work, and live is now rapidly transforming healthcare. Telehealth is a game changer, enabling our physicians, nurses, and pharmacists to deliver the top-quality, patient-centered care we're known for in exciting new ways. Baptist Health's Telehealth Center is the system's heart and hub. From here, two-way digital links connect our hospitals, our medical teams, and our patients like never before. The foundation of the Telehealth Center is the tele-ICU. Here, all Baptist Health critical care patients are remotely monitored in real time through a network of over 150 interconnected beds and mobile carts. Patients' vital signs are tracked and analyzed around the clock by tele-ICU doctors and nurses. Negative trends in a patient's health status trigger alerts, bringing an immediate medical response.
Hello, Mr. Perez. Are you having trouble breathing?
Yes.
I'm going to call your nurse, okay?
Hello?
I'm calling you regarding your patient in 2109, Mr. Perez. He looks like he's having some trouble breathing.
Okay, I'll check on him right away. Thank you.
Okay, I will let the doctor know.
The tele-ICU specialists can directly interact with patients and their hospital nurses and doctors to provide expert clinical support in an instant as part of the multidisciplinary rounds. Tele-ICU monitoring is not a substitute for the excellent bedside care provided by our hospital care teams. It's an additional level of care in keeping with our mission to improve the health, well-being, and safety of our patients.
Nurse, can you put him on oxygen?
Yeah, sure, right away, doctor.
Okay, this is the oxygen, okay?
Improved outcomes connected to the implementation of the tele-ICU encouraged Baptist Health's leadership team to strategically expand the application of the telecommunications infrastructure with the launch of the Transfer Center. "24 hours a day, 7 days a week, the Transfer Center is staffed with a physician, nurses, transport technicians, and a secretary. This team provides expert navigation across the entire system to expedite patients' access to the best resources to treat them. Whether that requires transfers between Baptist Health Urgent Cares and Baptist Health Emergency Departments, from one of the organization's emergency departments to another, inpatient or external transfers, Transfer Center staff streamlines the process, reducing transfer time and ensuring our patients get prompt access to the highest quality patient care services.
Dennis, let's go ahead and call a stroke alert. Yes, Dr. Scott.
Baptist Transfer Center, tele-stroke line.
Hi, we have a stroke alert in Trauma 1. We'd like to speak to a neurologist.
We'll call the neurologist on call and we will meet you in the virtual room as soon as possible.
Thank you.
Thank you.
For a patient in the emergency department experiencing stroke symptoms, time is brain. Baptist Telehealth's tele-stroke program provides remote access via e-carts in the ER to our neurologists, wherever they are located. A Transfer Center nurse coordinates the video consultation and ensures that all parties are logged into the virtual stroke room. In just minutes, a neurologist can perform a virtual consult to speed up diagnosis and treatment of strokes, often preventing unnecessary transfers to other facilities.
Good morning, doctor. We have a 65-year-old female coming complaining of right-sided weakness.
Okay, all right, nurse. I'd like to do a neurological assessment. Let's have the patient lift both arms and let's look for drift.
Mrs. Jones, could you please hold your arms upright for 10 seconds?
Okay, all right. I have a CT here. I'm going to pull it up.
Baptist Health Telehealth Center's capability to bridge time and distance is also breaking new ground in the area of tele-consulting. Passengers and crew of cruise ships miles out at sea can now receive psychiatric services not previously available to them through our tele-psychiatry service. Doctors can monitor their patients in between office appointments via e-visits, private consultations and virtual rooms that provide doctor-patient interaction without the need to travel to the doctor's office.
Do you think the medication that we prescribed helped you?
The medication is very good and my breathing is a lot better, yes.
Using in-home equipment, Baptist Health home care patients can transmit their vital signs to the Telehealth Center for close monitoring by a telehealth nurse who can evaluate any need for intervention.
Okay, what I want you to go ahead and do is I want you to take about half an hour and I want you to go ahead and retest.
Very good. Sounds like a plan.
Giving patients the support to manage their health in the comfort of their own homes helps them stay healthier, avoids visits to the emergency department, and reduces instances of rehospitalization. The tele-pharmacists can remotely provide personalized education to patients at home via telepharmacy, explaining dosages and answering questions.
Thank you very much, and we will talk soon.
Bye, Gloria. Thank you.
Have a great day.
Unconstrained by time and distance. In the hands of Baptist Health South Florida's team of qualified, compassionate caregivers, Telehealth is overcoming obstacles along the continuum of care, closing gaps, and expanding our ability to improve the health and well-being of the community we serve.